Hey there, fellow parents and caregivers. Welcome back to our channel, where we explore important health topics for our little ones. Today, we're going to dive deep into a fascinating yet sometimes unsettling phenomenon, breath-holding spells in children. I know it can be a worrisome experience for many of us, but fear not. We're here to provide you with all the information you need to understand and handle breath-holding spells like a pro. So, let's get started. Disclaimer: this is an educational video prepared by physicians with the intention of understanding the complexities of health and diseases and in no way intended to criticize or hurt any person, company, or segment of the community. The discussions in the video are backed by sound scientific evidence which can be referred to the literature for better understanding. The focus is on understanding health and diseases in a way that is helpful to patients, healthcare providers, and the common man, which often gets lost in translation in the current popular media culture. Have you ever witnessed your child react to sudden pain or upset by holding their breath, turning blue or pale, and fainting? If so, they might have had a breath-holding spell. But let me reassure you, these spells, also known as breath-holding attacks, are relatively common and typically occur in healthy children. As parents, we know how emotional it can be to see our little ones go through distressing situations, and breath-holding spells can add another layer of confusion. But don't worry, understanding these spells and their characteristics can bring much-needed reassurance and clarity. So, in this video, we'll explore the world of breath-holding spells, covering their causes, symptoms, diagnosis, treatment, and prevention. By the end, you'll feel confident in handling this unusual occurrence in your child's life. So, let's start by understanding the different types of breath-holding spells. Breath-holding spells are primarily categorized into two main types: cyanotic, blue, spells and pallid, pale, spells. Cyanotic spells, being the more common type, are often associated with temper tantrums or upsetting events. When a child becomes angry or frustrated, they might cry intensely, exhale forcefully, and then suddenly stop breathing. This causes their face, especially around the lips, to turn blue, hence the term cyanotic. The good news is that these episodes are usually brief, and the child spontaneously resumes breathing and regains consciousness. On the other hand, pallid spells typically occur after a sudden painful experience or a startling event. In these cases, the brain sends a signal through the vagus nerve, resulting in a slowed heart rate, loss of consciousness, and cessation of breathing. As a consequence, the child's face becomes pale. Like cyanotic spells, pallid episodes are also short-lived, and the child recovers consciousness without any intervention. Now that we know the types, let's explore what triggers these breath-holding spells. Breath-holding spells are primarily triggered by the child's response to distressing or upsetting situations. For instance, a child may experience a spell after crying intensely due to pain, fear, or frustration. It's important to note that these spells are not something the child does intentionally. Instead, they are involuntary responses driven by the child's reflexes. These reflexes temporarily alter their breathing pattern, heart rate, and blood pressure levels, ultimately leading to the spell. As parents, it's crucial to recognize the symptoms of breath-holding spells to provide appropriate care and seek medical attention when needed. After the child has the spell, they may lie limply on the floor and exhibit back arching, stiffness, and body jerking. Additionally, their skin may become sweaty, and in some cases, they may experience urinary incontinence very rarely, which if experienced definitely needs evaluation to differentiate it from an epileptic seizure disorder or a reflexic anoxic seizure. It's essential to remember that breath-holding spells are not seizures and do not pose any long-term health risks to the child. On the other hand, a seizure may present symptomatically like breath-holding spells, and hence the need to differentiate the two. Reflex anoxic seizures, RAS, are important in the differential diagnosis of non-epileptic paroxysmal events in infants and preschool-aged children. They are classically provoked by a sudden distressing stimulus, which causes loss of consciousness followed by stiffening and brief clonic movements affecting some or all limbs, often misinterpreted as an epileptic seizure. The underlying pathophysiology is a vagal-induced brief cardiac asystole with resultant transient cerebral hypoperfusion. Parents and carers who witness the event are understandably anxious, and the mainstay of management are ensuring the appropriate timely diagnosis of RAS and excluding cardiac arrhythmia. A detailed history from a witness is all that is needed to diagnose this condition, and investigations like EEG or neuroimaging should be avoided. RAS occur when a stimulus, such as pain or fright, leads to a vagally mediated cardiac asystole, resulting in cerebral anoxia. The asystole typically lasts under 15 seconds. Convulsions then occur due to cerebral anoxia. This differs from epilepsy, where seizures occur due to abnormal neuronal discharges. If your child experiences their first breath-holding spell, it's vital to visit the pediatrician for a thorough evaluation. The doctor will assess the child's medical history, family history, as there is a possibility that either of the parents would have had the condition in childhood and the events leading up to the episode. In most cases, no specific tests are required, and the pediatrician can diagnose based on the information provided by parents or caregivers. In rare instances, the pediatrician may refer the child to a cardiologist for Holter monitoring or neurologist for further evaluation with an EEG to rule out any underlying medical conditions. So, what can we do as parents when our child experiences a breath-holding spell? Fortunately, breath-holding spells usually resolve on their own, and they don't require extensive medical intervention. During a spell, parents should focus on ensuring the child's safety by gently laying them on their side, which can aid blood flow to the brain and promote quicker recovery. While there are no specific drugs or medical treatments for breath-holding spells, some studies suggest that iron supplements may help, especially if anemia is involved. However, more research is needed to establish a concrete link between anemia and breath-holding spells. Also, it's crucial for parents not to give in to a child's demands solely to prevent these episodes, as this may lead to behavioral issues in the long term. While we can't always prevent breath-holding spells, recognizing triggers that lead to these episodes can be helpful. By identifying potential stressors or upsetting situations, parents can take steps to minimize their occurrence. In some cases, distracting the child during tantrums might help avert a breath-holding spell. And there you have it, all you need to know about breath-holding spells in children. Remember, these spells may be unsettling, but they are typically harmless and outgrown by age 6 or 7. If you ever have concerns or questions, don't hesitate to reach out to your healthcare professional. As parents, our role is to provide a supportive and calm environment for our children during and after a breath-holding spell. By understanding and observing their behavior, we can ensure their well-being. Remember, knowledge is power, and being informed about breath-holding spells will help you navigate this phase with confidence. Thanks for joining us today. If you found this video helpful, don't forget to give it a thumbs up and share it with other parents who might benefit from this information. Be sure to subscribe to our channel for more valuable content, and until next time, take care, stay informed, and keep being amazing parents. Bye for now.